let's go to prevention. How do we prevent stroke? So there are two types of risk factors. One is non-modifiable, which we don't have any control, like age. Most of the strokes occurs after 65, or gender. There's gender disparity. There's a race and ethnicity disparity. Typically Black and Hispanic have more strokes than Caucasians. And then there are families who have strokes. So this we cannot touch. Now the next slide, this is very important. So if you see here, there are about 10 risk factors which we can modify. And this number 8, blood pressure, diabetes, high cholesterol, smoking, obesity, medication, heart disease, physical inactivity, stress, alcohol. Okay, so how do we know which one is the most important thing to control? There's too many things, right? The main goal should be controlling the hypertension. And if you look at our American diet, average is 3,400 milligram per day. And there has been proven again and again, we need to go around 2,000 milligram. Even American Heart Association, they recommend 1,500 milligram per day for everyone. And if you see 1 teaspoonful, it has 2,300 milligram. So be aware of the salt. I think, as I said before, 50% of the stroke you can prevent just by controlling hypertension, and the salt is the main culprit among others in the hypertension. There are few diets which have been proven scientifically to help. The Mediterranean diet and also DASH. So if you Google, you'll find all the protocols. How can you incorporate in your lifestyle? High blood pressure, most important. It causes atherosclerosis and also cardiovascular mortality. Now, before we used to go up to 140 systolic, the latest understanding is we want to go around 110, 120 systolic blood pressure. So if we can maintain around that, that'll be great help. Now, smoking. Again, smoking also causes carbon monoxide and nicotine. They reduce the amount of oxygen in the blood, but also damage the blood vessels. And the relative risk of stroke is about 2.5 times than non-smoker. So I would strongly suggest anybody who's smoking seek professional help. And the only one treatment what we know is quit now. Now, if you have stopped smoking for about 5 years, your risk goes probably close to 0. So I think 5 years is where you need to be very strong, and then it continues, could benefit. Diabetes, again, same thing. We want to keep it very well controlled. And it's not only the risk factor for stroke, also for the heart. And for example, if you see aspirin, which works very well for in other conditions, but if you have diabetes, its efficacy is reduced in preventing heart attack and strokes. So typically we ask you to keep hemoglobin 1AC less than 7. Some physicians, they even go 6.5 or less. The next category is carotid or other major artery diseases like carotid stenosis. Now, if you have narrowing up to 50%, it's fine. 50 to 69%, you worry a little bit. 69 to 90%, we really work on getting your risk factors controlled. And more than 90%, most of the time you have to go for surgery. So again, if we identify any carotid or other major artery disease, we need to focus on treating it. And another cardiac issue is atrial fibrillation, very, very common disorder. And if you have an Apple Watch these days, you can press the finger and it will record your heart rhythm, and you can know you have atrial fibrillation or not. What we have seen in some of the studies, even 40% of the patients whom we cannot identify any cause for stroke, they have underlying atrial fibrillation. It's an irregular rhythm of the heart. It creates a clots which go to the brain and can cause stroke. Now, most of the patients, if they have atrial fibrillation, we can put them on very safer medication called Coumadin, which was old, but the newer one, they are really, really good and with very little side effects. So other conditions which can cause stroke, mechanical valves, another blood disorder, excessive alcohol use, illegal drugs. Many times when I'm on call, people who use cocaine or any speed drugs, they come with either hemorrhagic or ischemic strokes. Another one risk factor is high cholesterol. We really work with the patient and keep the total cholesterol less than 200 and LDL less than 100. And the next risk factor is physical inactivity and obesity. So as I mentioned before, aim should be BMI less than 25, and then activity at least 30 minutes, moderate, vigorous exercise every day.